everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. Today, I'm going to be spending some time with you talking about chlamydia infection, and we are going to be looking mainly at the symptoms of chlamydia in men and women. If you're new to this channel, this is a channel where we educate ourselves on common health problems. So I'll be very glad if you hit on the subscribe button and also on the notification bell, so you will be amongst the first to be notified anytime I upload a new video. Before we get to the signs and symptoms, I want to give a brief overview of what chlamydia is. Chlamydia is a sexually transmitted infection caused by a bacteria called Chlamydia Trachomatis. Chlamydia is very common in both men and women. It is particularly common in sexually active teenagers and young adults, but you can get this infection at any age. In the UK, for example, it is one of the most common sexually transmitted infections. The bacteria are usually spread through sex or contact with infected genital fluids, such as semen or vaginal fluid. You can get chlamydia when you are involved in an unprotected vaginal, anal, or oral sex, where you use no protective barrier. That is, you do not use a condom with someone who is infected with the bacteria. Another way also that you can get the infection is through sharing of sex toys that are not washed or covered with a new condom each time they are used. Also, when your genitals come into contact with your partner's genitals, this means you can get chlamydia from someone even if there is no penetration, orgasm, or ejaculation. Also, when infected semen or vaginal fluid get into your eyes. Chlamydia can also be passed on from a pregnant woman to her baby. Please be aware that chlamydia cannot be passed on through casual contact, such as kissing and hugging, or from sharing baths, towels, swimming pools, toilet seats, or cutlery. Now let's move on to our main focus for today, symptoms of chlamydia infection. Most people with chlamydia don't have any symptoms at all. If you do get symptoms, they can appear after a few days for some people, but usually symptoms would appear between 1 and 3 weeks after having unprotected sex with an infected person. For some people, they don't develop until many months later. Even if the symptoms disappear, you may still have the infection and be able to pass it on. Chlamydia symptoms in men can include pus or watery or milky discharge from the penis, pain or burning when urinating, pain and swelling in one or both testicles. You can also get chlamydia in your anus, usually from receiving anal sex. Symptoms are not common, but you might notice a painful or itchy anus, discharge or bleeding from your anus, diarrhea, swelling in or around your anus. Chlamydia can also infect the eyes, causing redness, itching, or discharge. If you notice any of these symptoms, or if your partner has been diagnosed with chlamydia or another sexually transmitted disease, or if your partner has symptoms, then it will be very important to check in with your doctor or nurse or your local sexual health clinic immediately. Now let's move on to the symptoms in women. At least 70% of women do not show any symptoms at all, or the symptoms show up weeks after having sex with someone who is infected. Even without symptoms, untreated chlamydia can damage your reproductive system. It can cause pelvic inflammatory disease or lead to infertility. And this is the reason why it is important to get tested for sexually transmitted diseases, especially if you've had sex without a condom with a new partner. Chlamydia symptoms in women can include abnormal, yellowish, or strong smelling vaginal discharge, swelling inside your vagina, painful sex, pain or burning when you're urinating, the urge to urinate more than usual. If the infection spreads beyond your vagina and cervix, symptoms of chlamydia in women may include pain in your lower abdomen or lower back, nausea or fever, bleeding between your periods or after vaginal sex. Women can also get chlamydia in the anus, usually from receiving anal sex. Symptoms are not common, but you might notice a painful or itchy anus, discharge or bleeding from your anus, swelling in or around the anus, and chlamydia can infect your eyes, causing redness, itching, and or discharge. Our next question is chlamydia a serious infection? And the answer is yes. Chlamydia infection can become serious if you do not get checked early enough to get the necessary treatment. In women, if it is left untreated, it can spread to the womb, the ovaries, and the fallopian tubes and cause pelvic inflammatory disease, which can lead to ectopic pregnancy, persistent pain in your lower abdomen, and infertility. If you develop chlamydia during pregnancy, you can pass it on to the baby, and the baby can be born with an infected eye or a lung infection, or your baby could be born with a low birth weight. It can also increase your risk of premature labor and birth. Because of these complications, it is important that if you notice any of the symptoms I mentioned earlier, or if your partner has been diagnosed with chlamydia or another sexually transmitted disease, or if your partner has symptoms, then it is important that you check in with your doctor or nurse or contact your sexual health clinic for help. In men, if chlamydia is left untreated, the infection can cause swelling in the testicles and also swelling of the tubes that carry sperm from the testicles, and this could affect your fertility. Another complication that can occur in men is called reactive arthritis, and this is where your joints, your eyes, or the tubes that help you pass urine out of the body become inflamed, usually within a few weeks after having chlamydia infection. You know, getting tested is the only way to find out if you have chlamydia or not. And you can get tested whether you have symptoms or not. Get a test if you've had unprotected sex with a new partner. If a condom splits whilst you're having sex. When you or your partner have had unprotected sex with other people, or you think you could have a sexually transmitted infection, or a partner tells you they have a sexually transmitted infection, or you are pregnant or planning a pregnancy. For men, the test involves taking a urine sample and sending it to the lab. And for women, it could be a urine sample or a swab of the infected area that is taken and sent to the lab. Results come back after about 7 to 10 days. And if it is positive, then you will be prescribed an antibiotic to get rid of the infection. If you take the antibiotic the way it's been prescribed, then you're sure to get rid of the infection completely. Before we come to the end of this chat, there are a few very basic precautions that I want to share with you, and these would help prevent chlamydia. 1, use condoms whilst having any kind of sex, that is vaginal, oral, or anal sex. 2, avoid sharing sex toys. 3, do not change partners frequently, and even if you do, then remember to use condoms. And 4, see a doctor for regular health checkups. Taking these precautions is also necessary for preventing and spreading other sexually transmitted infections. I hope you have learned something today. Please give this video a thumbs up. Remember to share with family and friends. And if you haven't yet subscribed to this channel, please hit on the subscribe button and also on the notification bell so you don't miss any video that I upload. Leave your comments, your questions, and your suggestions in the comment section. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.